Welcome to What's Happening at Tri-City Medical Center. Our guest is Dr. Samani, and she's here to discuss heart disease in women. There are significant differences between men and women in the epidemiology, diagnosis, treatment, and prognosis of cardiovascular disease. These should be taken into account in the care of women with known or suspected cardiovascular disease. We'll be covering these differences with Dr. Samani. Doctor, thanks for joining us.
Thank you so much for having me, John.
So how different is cardiovascular disease in men and women in terms of how prevalent it is?
Actually, cardiovascular disease present almost 8 to 9 years later in women. And because the female sex is associated with a longer life expectancy, so in general, women constitute a larger portion of elderly population that they are living with some sort of cardiovascular disease or they die from cardiovascular disease. The other thing is that between age 45 to 65, 1 in 9 women develops some sort of cardiovascular disease, but this incidence increase after age 65. And we have 1 in 3 women that develops cardiovascular disease after age 65. So the prevalence is different.
Well, it sounds, though, like it's a lot closer than most people suspect. I mean, it's overwhelmingly viewed as a men's issue, I think, in people's minds. So that's valuable information.
Exactly. And actually, there are some alarming statistics showing that cardiovascular disease is increasing even in younger females, such as like age 35 to 45.
So what are the differences in the risk of cardiovascular disease between men and women?
Actually, there are still many common clinical risk factors in both ages, such as high blood pressure, diabetes, high cholesterol, obesity, or physical inactivities. But there are some gender-specific risk factors for women, which I go through them briefly. For example, menopause. Postmenopausal state is associated with higher cardiovascular risk disease. The other things, such as pregnancy-related complications, because some women developed high blood pressure or diabetes during the pregnancy. Having history of hysterectomy or removal of the uterus or womb or removal of ovaries in women can increase cardiovascular disease. Also, studies showed that the prevalence of inflammatory disease or rheumatological disease or higher in women, which can be associated to cardiovascular disease. And in general, psychosocial stress, which is a risk factor for cardiovascular disease, known to be higher in women. So there are some gender-specific risk factors for cardiovascular disease in women.
What about the presenting symptoms? Are they different?
They are different. Still, the most common presentations of heart disease is for example, heart attack is having chest pain at the back of the chest bone, which comes with exercise or activities. But even this common presentation could be quite atypical or kind of unusual in women. Women may not present with this straightforward symptoms. They may have a heart attack, but they come with chronic fatigue, nausea, vomiting. And interestingly, sometimes a heart attack can show itself usually with chest pain coming with exercise or activities, but in women, there are some other triggers such as mental stress, sometimes rest, and even sleep can be trigger for heart attack in women.
What about the issue of hormonal therapy with women?
So there are so many controversies about this topic, actually, and there are so many studies done to evaluate the effect of hormonal replacement therapy in a woman. There are 2 major clinical trials done on many hundred women to see if hormonal replacement therapy can prevent cardiovascular disease or not. But the answer showed that there is no role for hormonal replacement therapy in prevention of cardiovascular disease, and actually it may produce some harm. So as a result, the American College of Cardiology, or ACC, recommends not to do hormonal replacement therapy to prevent cardiovascular disease, and actually it recommends that hormonal replacement therapy needs to be stopped after heart attack. However, if the risk benefit the benefit outweigh the risk, then it can be taken into account. But the decision of taking hormonal replacement therapy entirely need to be made by the physician.
Well, if that's problematic as a preventative, what are the preventative actions that you recommend women take?
Actually, I would say the most preventive aspect of cardiology is to minimize the risk factors, losing weight, having more physical activities, trying to control like the risk factors such as blood glucose or sugar or like diabetes, and also try to eat healthy can prevent these risk factors. But in general, I recommend that women aged 20 years or older, they benefit from having periodic risk assessment by their primary care physician or cardiologist at least every 3 to 5 months in order to identify their risk factors sooner and to treat them at earlier stages.
One of the things I think we should explore a little more, because we passed over it quickly, was the issue of pregnancy and heart disease in women. Can you expand on that a little bit?
Absolutely. Pregnancy acts like a trigger. Women that they never had hypertension or high blood pressure before pregnancy, they could develop signs of high blood pressure during pregnancy, which can be actually without any symptoms, but with having a regular checkup or a periodic assessment, the physician, they would figure out that they have a high blood pressure. And this high blood pressure may stay with them after pregnancy, and some of them, they may need to have medication therapy after pregnancy to control the hypertension. So basically, pregnancy is a risk factor which can kind of unmask the underlying high blood pressure in women.
Is it a serious enough issue where you would recommend that women who are considering pregnancy and who have not had a risk factor analysis do so?
Absolutely. I would say we have some pre-assessment before pregnancy, which can be done by the physician to make sure that the women, they are fit to undergo the pregnancy. And of course, evaluating the hypertension and the other related clinical risk factors are part of that assessment.
Well, we have a little more than a minute left, and I'd like to give you a chance to talk about what you think is the most significant issue in the treatment of cardiovascular disease today.
If I want to actually relate them to like both gender, not necessarily women, I would say preventive medicine. I would say there are 3 approaches to look at these interventions. One is mass education of entire population to make them aware of cardiovascular risk disease and also to help them to identify them at earlier stage. 2 is to treat the people who have already some sort of clinical risk factors such as high blood pressure, diabetes, or cholesterol or obesity. And the 3rd is to identify people with established or with cardiovascular disease and try to treat them with lifestyle changes, behavioral modifications, medications, and sometimes with some sort of cardiac procedures or surgeries.
Well, that's great information. I think people will pay attention. You presented it very well. Thank you for joining us.
Thank you so much for having me.
You've been watching What's Happening at Tri-City Medical Center. I'm your host, John Bonosoro, and this series will keep you informed about health issues, events and services at Tri-City Medical Center, and provide you with information for a healthy lifestyle. Watch for more segments in our series, What's Happening at Tri-City Medical Center. And remember, you can see this and all KOCT programs by logging onto KOCT.org. Thanks for watching.